I am here at the annual meeting of the North American Menopause Society, and I'm speaking with
Dr. Neil Binkley.
And you are?
I'm a geriatrician at the University of Wisconsin-Madison.
He really gave a wonderful talk today on a topic that I think, I don't want to say will bring you down, but it's on falling. So how common are falls in women or in general as we age?
Unfortunately, really common. So somewhere around a third of adults over age 65 fall every year, and after age 75, that's almost 50%.
Now, one of the things that you said that sometimes people don't think about as a real consequence of falling is they can lose their independence.
That's exactly right.
And what are some of the things that people can do to prevent falls?
Okay. Much of this is simply common sense. But one of the biggest factors leading to falls risk is muscle weakness with advancing age. Mm-hmm. The $95 word for that is sarcopenia, but we all have recognized older adults who have difficulty climbing steps, getting out of the chair, getting off of the toilet, etc. Mm-hmm. And those individuals, in essence, can be thought of as having sarcopenia. So we need to do things to keep our muscles strong. Exercise is obviously the cornerstone of that. And it doesn't have to be going to the gym and putting 50 pounds on your back, just
right.
Walking, climbing steps. Something that I didn't emphasize today as far as muscle strength is protein intake. Mm-hmm. And it probably doesn't matter whether the protein comes from animals or vegetables, in that they're broken down to amino acids, and those are the building blocks of our muscles. So activity and protein intake, as well as enough vitamin D, is important. A second thing that is really important in reducing falls risk is looking at all of the medications. Mm-hmm. As we age, we tend to see multiple healthcare providers, and we get prescribed drug X, Y, and Z, and pretty soon we're on 10 medications. They're interacting.
You said the average person's on 10 medicines.
8 to 13.
8 to 13.
And so, that's a lot of drugs.
And even over-the-counter ones can make you fall.
Indeed, and the big hitter there is antihistamines, mm-hmm. such as Benadryl, for example. Mm-hmm. Antihistamines have anticholinergic effects. They can affect our thinking and our balance, and cause us to be more likely to fall. So minimizing medications, diet, and exercise are really straightforward, common sense things that we can do.
Now, one thing you said that was very interesting is to practice getting up.
That is, if indeed you fall on the floor, practice getting up. Mm-hmm. So rather than waiting until you've fallen and saying, how do I get up? Mm-hmm. Going and thinking about getting up off the floor. And in that regard, there's a wonderful document that you can find online from the Ministry of Health in New Zealand called Love Your Independence. Mm-hmm. And it's written for people. It's very commonsensical. And in there's nice pictures that describe what to do. And it's basically to scoot over to a solid chair, to get into a sitting position, grab onto the chair and sit down on the chair, and then get up from there.
Well, you gave a lot of great information.
Thank you.
Okay, thank you very much.